Our final panel today focuses on the agenda for research on mindfulness and public health. We're going to hear from each of our four discussants in turn. They are first Dr. Walter Willett, then Dr. Elli Weisbaum, then Dr. Zev Schuman-Olivier, and finally, Brother Phap. Walter, to you.
Thanks. Actually, I'm going to take just a few minutes because this is a discussion panel. And mostly we organized this day because we wanted to hear from people outside of our own group and have a broader perspective about what we might do in our research to complement what other people are doing across the city, across the country, across the world. But just a couple reflections, having heard an amazing number of talks this morning and this afternoon so far. Clearly the challenges before us are huge. And we heard right at the beginning from John about the scope of the challenges that we have before us, enormous. And it's not, and they now come with a time fuse on them almost too, especially with climate change and global warming. So there's a sense of urgency, I think most of us feel, that hasn't been there so much until recently in what we do. And we've also heard that we need to be, in fact, one of the reasons for us having this at the School of Public Health is the issue that everything is connected with everything else, the interconnectivity aspect of mindfulness, and it's the core of public health. But how can we both have expertise and depth and also be engaged in every dimension almost infinitely? It's too much to ask of anyone human being, I think. There's a reality factor here that our resources as individuals are finite. And that's one reason we work in groups. But also go back to something one of our former deans discussed also, is that we should be turning out people who are T-shaped. And this is Julio Frank. That people who have great expertise in a specific area, for instance, if they're working on a vaccine for COVID, you want to have them developing the right antibody for the right spike protein. And you have to be quite focused doing that. But also, we should have people in our community who also have breadth as well. It can't be the same depth for everything we do. It's just not literally humanly impossible. So that's something where mindfulness can add to both of those. It can make us more effective in the deep part of the work we do, but also help us connect our efforts with the efforts of everybody else around us. And also, one of the things I've taken away here is to the importance. We were reminded by a number of people that while mindfulness itself is important, we have to pay attention to the context. In isolation, it's not sufficient. We need to have a moral aspect. We need to focus, develop community, and that all will make us more effective for sure. So I think that's what I'm going to say for the moment, and I look forward to the comments of others.
So I'm going to jump in. I know we're discussants, but I have some slides. So I'm walking over here because I get to enjoy standing on the box, apparently, for my height. So I was grateful to do that. So hello, everyone. I'm going to introduce myself and then share some slides with you. So I have a slide. My name is Elli Weisbaum. I've come down from Toronto, Canada, traditionally the lands of the Huron-Wendat, Senecas, and the Mississaugas of the Credit, still the meeting place of many Indigenous people from across Turtle Island. Grateful to have the opportunity to work and learn on that land. I have so many identities and ways I could introduce myself, but for the sake of the countdown timer, I will just add I wear a few hats at the University of Toronto. I'm currently an assistant professor in the Buddhism, Psychology, and Mental Health program, this beautiful little gem of a program where we get to bring together and nerd out on the neuroscience and the sutras. I'm also cross-appointed to the School of Public Health, And I'm currently getting cross-appointed to the Faculty of Medicine there, where I did my PhD research that I'm going to share a little bit about, looking at how Thay's teachings can impact the wellness and community and ecosystems of physicians and the communities of which they are part. On a practice side, I started practicing, went to my first retreat with Thay when I was 10 years old. So I had the joy of going through children's program, teen program, and then being part of Wake Up. And this got me really interested. I think one of my first research questions when I would get back to my high school and say I was on a retreat with a Buddhist monk, and everyone was like, "What were you doing?" And I started trying to think, how do you answer that question? And it occurred to me as a teenager that I didn't have to stand in front of my friends and say, "Excuse me, I'm deeply listening to you." To hear their suffering, and also to take care of my own as I listened to it, that relational and communication skill set that I had been building at these retreats with these experts in what does it mean to be human and to research our minds. And so these are some of the curiosities that bring me to my current work that I'm excited to share about, and also some of the questions I have for what we might be doing here in this center. So I put up this title because I wanted to look at our day. We have been invited to the inaugural Symposium and launch celebration for the Thich Nhat Hanh Center for Mindfulness in Public Health. And as a researcher, I like to unpack things. What can I see in this name? And so I see these two things. And for me, this is really this invitation to look at bringing together different knowledge streams. And it reminds me of a quote, thank you, John, from an article I read when I'm actually sitting here with most of my literature review, so thank you, all of you. You're all with me when I teach my methodology courses. My students were so excited. They're like, I have this question for Van Dam. Please ask him this question. But really, this aim of bridging these two different epistemologies of science and Dharma, perhaps that is our research agenda. And to ground that in a quote, this actually starts my dissertation. It's 400 pages if you want to read it on T-Space. But it's from a book, The Sun, My Heart. I would say mandatory reading for any of us interested in the ontology and epistemology of Thich Nhat Hanh. And I'd like to just read you the very first paragraph from the introduction. Meditators since the beginning of time have known that they must use their own eyes and the language of their own times to express their insight. Wisdom is a living stream, not an icon to be preserved in a museum. Only when a practitioner finds the spring of wisdom in his or her own life can it flow to future generations. Keeping the torch of wisdom glowing is the work of all of us who know how to clear a path through the forest in order to walk ahead. And for me, this quote has always been this invitation, but also permission to make it the language of my times. I share this with my students in all my courses, especially my research courses. I was like, join the stream. You know, we're part of this together. So we'll come back to this, but I wanted to share this with you. And as a qualitative trained researcher, I always like to say context is so important. We're interested in what we would call a settings approach. So what I want to do now is just briefly give you an overview, two little case studies of some work I've been doing. And my hope is that this adds to the discussion, not that you'll do the work exactly as I've done it. In qualitative research, we're actually not interested in replication. We're interested in transferability. How can I illustrate what I've done so that it illuminates what you might do in your space? And so I briefly want to share a bit about my PhD research study. It was a qualitative study conducted with physicians across many different specialties, cardiology, emergency surgery. The full protocol is published. Please look it up. If you want a copy of in Canada, we say REB, you say IRB. I've been working with Diane. I'm happy to share it because we don't need to keep reinventing these wheels. What I want to just clarify, some novel things about it was we did the Applied Mindfulness Program for Medical Personnel, what we're calling AMP. And this is a program based solely in the teachings of Thich Nhat Hanh. And so really looking at how do these practices transfer and translate into clinicians' lives. And in this program, we studied the Four Noble Truths, the Eightfold Path. Top hits for physicians were the 4 nutriments and storehouse consciousness. Don't quite have time to teach them now, but the 4 nutriments, looking into what do we consume beyond edible foods, what is our collective consciousness, looking at our seeds, what am I watering day to day, right? When the nurses stand around and just share case studies with each other, but don't say that they're having a difficult day. What can we change in connection when we look and learn together? So top hits, some people said, you'll scare them, it's too Buddhist, and we gave our citations, we let them know our sources, and it was met with a lot of enthusiasm, or what we would say acceptable and tolerable to the population. I also just want to note that I took a precedent from indigenous research methodologies that propose having an iterative reciprocal relationship built with the wisdom community upon which you are drawing knowledge. And in this tradition, I pitched this to my program advisory committee, my PAC at the university, and we made what we called our MAC, our Monastic Advisory Committee. Hello, they're all here. Please wave. They read 400 pages. And that was an interesting time also to think about what are our learning environments. As academics, as PhD students, I've been told it takes at least 2 years to heal from that experience because of the way we give critique. And so I was also interested. I was getting feedback and comments from a PAC and a MAC. And the MAC was not light on me. I was using the term engaged mindfulness. We've called it applied mindfulness for a reason. Ty had proposed a new meaning, and we can talk a little bit more about that. As a researcher, I want to be precise. What type of mindfulness are we researching? So that's a conversation for another time. But they called me, we can say called me in on a few things. Brother Phap in my ontology section was like, this is very nice. You have missed. And then also said, I'm sorry, I don't know the citations. Please go find them. So that was an adventure to work with them. But it was really a chance to bring together these different knowledge streams. You can hear the language each of us uses up here, I think is very complementary. But when Sister Dedication shares, there's a flavor to that. And can we bring that into our work? What does that look like? Very briefly, findings paper is currently in review in CMAJ, but I just wanted to share a few quotes from participants because I like to stick closely to what was said. And this term, a way of life, in our thematic analysis, this was one of the key findings, that mindfulness permeates life. Some of the participants came in thinking, I'll just do this for 20 minutes and hope it lasts for the day. And then they were like, wait, it's actually on demand. Once you start living it, once it's how you walk, how you breathe, it changes who they were with their patients, with their colleagues, and with their children. Flying, it takes me an hour to do a full presentation on that at grand round speed, so we'll leave it there. I also just want to share a little bit about what I'm doing in the undergraduate courses I teach, because I think something we're hearing all day here is, what is the environment that we're in, and how might mindfulness permeate that, right, beyond the cushion? And so in my courses, I'm really interested in playing with, like, what are assignments? You know, I have some standard things like annotated bibliographies where everyone sitting here is referenced, and the students pick a certain research topic. And then we also do things like weekly practice logs. I'm embedding mindfulness practices, walking, eating, sitting, all kinds of stuff into the classes, and it changes the environment. Before an exam, the whole class comes in and we sit together. We talk about caring, not calming our nervous systems. We need them active for the exam. But we talk about calming them. And students sit there, and they're allowed in the exam at any time, if they want, to stand up and do a walking meditation around the room. And we have a collective agreement on that. And the feeling in the exam room, it's different. I've also had many of the monastics here as co-instructors in my courses and as guest lecturers. And again, this ability to really bring these knowledge streams together, as we can hear today, be inspired by each other's learnings and knowledge, has been so important. I also like to tell my students, you want a good rationale for anything we're doing. And so another reason we do these practices in the classroom is if they're going to read your papers, peer-reviewed journal articles that I'm telling them to annotate, and they want to have a reason to analyze, did an intervention work? They need to be familiar with the material, just like a good surgeon can analyze a new best practice based on their own lived experience. I just briefly wanted to share a few quotes from my students from their course evaluations. When I read these are from, they're anonymous, but they really talk a lot about safety. And I just want us to imagine, like, the academic spaces we're often in, the isolation, the competition, the fear. And my students, they present on these in their courses. They come to class. Brother Phap and I co-taught this winter, and I just wanted to share, one student said that Plum Village was one place where he felt safe in the world, and I feel that in our classroom. And so for me, this is really what I aspire learning environments may become. And so this just brings me to a calligraphy from Ty, "Happy teachers will change the world." This proposal he had, and I know that. I know the way I sit down, what is happening in my internal landscape when I go to grade their papers changes the grade I give them. I know the way my students show up and listen to each other in the classroom means that students who wouldn't normally raise their hands are speaking. I have students who are coming out in class for the first time, who have never, to their families, because they feel safe there. And I'd like to propose in the center that we start thinking about what other happy people might change the world. Researchers, students, staff, admin, clinicians, parents. And that we start to think about the ecosystems of which we are part. I'm close to the end, so I'm just going to bop through some challenges and acknowledgements. But I think as a field, if we're thinking about bringing these practices into these spaces in this whole embodied way, we're saying, don't just use one part of the Eightfold Path, use it all. We need to really acknowledge the spaces that we are going to and what we are meeting. And so just from my experience, this is a common response amongst clinicians and educators to saying, we have a well-being mindfulness initiative. And I think this is because it's often been treated as a one-off pizza party. Some real damage has been done in this field to say, you, the individual, get better. Do this thing that we know is good for you. And so we need to honor that and really think about the language we bring in. In fact, you can have my slides. These are 2 points I actually usually share before I say anything else. And to really acknowledge what we heard already, there is no one modality. That's going to be a misconceptualization of our field. And so some language around that is important. Rigor and critique in our work to meet other fields where they are. And I want to point out this is incredibly congruent with the ontology and epistemology of Thich Nhat Hanh. My parents have a calligraphy in their house that says, if you're sure, check again. I think this is in the highest value of scientists. So I think everything I know as a scientist is congruent, and I get new language and new training every time I listen to a Dharma talk from this community. So, to conclude, so much is possible. I want to ask you this research question. Maybe this can be part of the agenda here. How can we research mindfulness while mindfully researching? So what are our spheres of influence? You've already heard here, you have this space. How does the group that is meeting about this, how do you begin your meetings and end them? Thai would say, go as a river, not as a drop of water. So when we feel overwhelmed, there is so much to do. We do not have to do it alone. We felt that river today. And so just to conclude, from Brother Phap, who's here, this isn't about the 1-year vision. It's not about the 5-year vision. It's the 100-year vision. Brother Phap, who recently gave a Dharma talk to young wake-uppers, said, what's being said today is perhaps not as important as our connections with one another. So with that, I'm so grateful to connect today. I hope this is the beginning of many wonderful things, and just some photos from my work, rearranging classrooms at the university, being in Dharma halls in Upper Hamlet. A delegation has come here from Plum Village. Perhaps you can send a delegation there. We have laughed on top of mountains. These are a bunch of scientists at a neuroscience retreat we organized there. And just really to say, let us go as a Sangha and community. And thank you for listening.
It's been a wonderful day. I don't have any slides. But I'm going to do my best to... You can't hear me? Okay, I'll try to talk louder. Can you turn me up? Thank you. I want to thank the organizers for the honor, the privilege, and the challenge of being a discussant and trying to wrap up and integrate everything from today. There's been so many wonderful speakers. The first thing I wanted to say is I really wanted to welcome everybody here and welcome the center. I'm the director for the CHA Center for Mindfulness and Compassion, affiliated with Harvard Medical School. I'm one of many researchers and clinicians and teachers in the Harvard community, and there have been so many seeds planted in the Harvard community to allow a center like this to be able to come and grow strong roots almost immediately and to have this amazing conference. So both of the labs, Sarah and Dave was here, the Benson Henry Institute, which had its own contributions to the ways that we understand some of the opportunities that mindfulness can provide here at Harvard. The Osher Center of Integrated Medicine, which has really created and helped support an integrative research environment here, as well as Alan Langer and at the university, Harvard Wellness itself, which I think we're very excited to collaborate. I can't speak for them, but they're here, as well as emerging labs like Matthew Sachet at MGH and Christian Webb at McLean. So as a medical school, I think I can't speak for everyone, but I'm very excited about creating a collaborative environment together, and I think that's important for the kind of research we want to do. Because at the heart of it, mindfulness, we've been talking about love, we've been talking about community, and I think that's a big part of why we're doing this research as well. So I'm looking forward to that together. I'm excited that this is going to be in the nutrition school. When I think of nutrition, I think of what we eat, what we ingest. And if you think about the 6 sense doors, it's not just anymore what we eat. It is also what we allow to arise in the mind, what we connect with in the environment. And I really want to encourage, and I hear all the speakers really encouraging thinking about perhaps nutrition in that even broader way. This is an exciting moment to have the center, and I think it is really the time for a center for mindfulness and public health. As a community center embedded in the community of the major community health, public health teaching hospital at Harvard Medical School, I feel like we have really seen this massive influx of interest in the mindfulness work that we're doing, and we've really moved through the early adopters and moved into next phases of people and the communication skills that the public health school has and the capacity to be able to think about how to reach beyond just the people here in this room or the people who maybe already agree or are already open is really important. So I really encourage to think about that impact. And kind of getting at that is that it is in our clinic. So we created the Mindful Mental Health Service within our healthcare system. And what I find is that actually the delivery of mindfulness in our groups is impactful, but the moment of impact actually is happening when the coordinators on our team call and start to try to explain to someone why they were referred by their doctor to a mindfulness program when they don't even know what that is. And so that mindset and motivation, that willingness, openness to be able to learn is maybe one of the most important things, and that's a place where the public health school in particular, I think, can start to impact the national, international conversation. Within that context, mindset and motivation is very much impacted by who's teaching it, by the power structures within which one is trying to learn mindfulness. And we really need to take into account the presence of trauma, and I think you heard that coming from the speakers, but also collective and historical trauma. We need to really acknowledge the impact of white supremacy, and it would be very important. One of the things I really appreciated about public health, about the symposium, is how open everyone in the leadership has been to kind of learning and hearing what's needed. And I think one of the things that's really been needed is also some additional representation, even here up among the speakers. As scientists, there are a lot of scientists of disadvantaged minorities in our country who are doing amazing work, and it's really important to make sure you hear their voices and that they're in the leadership in some way. We actually did a survey of academic mindfulness centers associated with medical schools back in 2014, and we were able to see and track it every about 3 or 4 years to see how the growth was. And even by 2018, prior to the pandemic, nearly all mindfulness center directors were white, and most were white men. And as a white man, I'm embarrassed about that. And I hope that as we get into the next generation of mindfulness centers for the public health, that the kind of conversations that we're hearing about today about context, about power, about the potential to actually have to pay attention mindfully and notice all the intersectional injustices that may arise, and be able to be well positioned to connect with communities that need mindfulness or that could benefit from it. I hope that as you're considering, how this center arrives here at Harvard, that we really can cultivate that opportunity here. I'd say in our center, when myself and the medical director became directors, I don't think we were. I was not fully awake to the regular harms day to day, and I hope that some of the changes that have happened in society and some of the awareness in the mindfulness community can really be brought in to the work that's happening here, and that this center doesn't make some of the mistakes that other mindfulness centers made in incorporating and setting up largely white leadership teams. So that's an important thing to say, and I think it's a huge opportunity that can be made. The fourth thing is one of the things that John has talked about is that mindfulness is not just mindfulness; it's also heartfulness. And you've heard this coming through, but I really want to encourage the opportunity for explicit communication about the power of compassion, about the power of kindness, and the power of love, and how important that is for us in doing this work. And that part of what mindfulness may be doing is opening up our capacity opening ourselves up to the capacity that's already there for that. And as John said, we already have it. We just need to access it. And attention is one of the things we cultivate to access it. And I believe that kindness and kindness towards ourselves is often necessary, especially in this country, for us to be able to really access what is available to us through mindfulness. Willem and Nick and others talked about not enough or too much. And I think that that's really important, and a lot of that comes down to trauma, equity, belonging, and can people get the practice within the context that will work with them to be able to turn towards and warmly be with whatever it is that they're experiencing, without getting caught up in perhaps the what was discussed as the historical things historical burdens of our grandparents that are within us that can lead to our not being able to see what's here. I want to talk. I guess another thing was Eric talked about the importance of bringing this more widely and making it and focusing on implementation and the role of health insurance. And I think that's very important. What we've done at our Center for Mindfulness and Compassion at Cambridge Health Alliance was actually create an insurance reimbursable model, referral-based model within the healthcare system to try to address some of the equity issues that are happening within the mindfulness work. We actually were able to do this across 12 primary care sites. We had more than 5,000 referrals. And in 3 RCTs, we found that people had 2.5 to 4 times the odds of actually initiating behavior change around chronic illness, self-management, or health behavior if they went through 8 weeks of mindfulness in a standard MBP compared to just an hour of mindfulness. So that's kind of speaking to some of these dose questions. One of the things that's important is that everyone that was enrolled in that study or that joined this group wanted mindfulness. And one of the things we see is that when people when people come into mindfulness and it's blinded or it's compared to an active control and they don't know, and they don't necessarily know they're going to be getting mindfulness, our experience has been that actually people don't always do as well or want to stay connected to the mindfulness program. So it's really important to avoid the possibility of coercion or having people in mindfulness programs when they don't want to be. So that's when I heard the school data and I was thinking, Willem, I was wondering about how much is that a product of power structures within schools and teachers saying, now is the time you have to sit and be quiet and be mindful, and that's how it's interpreted. And because of the power structures, it's particularly difficult for people to be able to open to the possibilities that might be in front of them. So we want to really think about, when we think of public health strategies, how to not end up turning it into coercion, and really have an approach philosophy that you're trying to suggest. Last thing, just is really to say that I believe in the power of community and that I'm really excited to be in community with everybody here as we go forward. So thank you for inviting me to be a part of this.
So, dear respected Thầy, that is our teacher, Master Thich Nhat Hanh. Yeah. Dear respected Thầy, dear respected brother and sister, and dear respected honor guest, distinguished guest today. I'm overwhelmed by all of the presentation, so I'm speechless. And Elli said that the one who didn't speak in the class, perhaps they speak something. So may I invite everyone after this long day of listening, we come back to ourselves and I do a little bit of guided meditation before I continue. Yes? So please sit with your back straight and your shoulder relaxed. That's what I do all the time. I don't know about research and slide. So I know about sitting with my back straight and my shoulder relaxed and coming back to our in breath and out breath. Yeah. And may I invite the bell? Gently coming back to my body and my mind, I enjoy my in breath and my out breath. It is so wonderful to return to myself, to feel myself, and to be present for myself. It is so wonderful to be here for the historical launch of Thich Nhat Hanh Center for Mindfulness in Public Health. I feel so joyful and happy to be a part of this process. Enjoying my in breath, I breathe in. Enjoying my out breath, I breathe out. Allowing my in breath to penetrate deeply into my lower abdomen, I breathe in. Allowing my out breath to relax my whole body, I breathe out. Deep in breath into the lower abdomen, relaxing the whole body. So thank you very much for participating with me. I have been asked by Dr. Walter Willett on a Zoom meeting that we had a few weeks ago about the session that we have at the end of the day. And I've been allowing myself to be empty of thought, to receive whatever is given to me today. And it's very overwhelming of all of the work and all the wonderful speaker that we have heard. And it's so wonderful. And I also been asked about the direction of the new center. So I've been thinking about it. What can we do in the next 10 years, 20 years, or 30 years for this new center? So this is my only crazy thought. I'm a dreamer, so it could be not realizable, but I share whatever I have in my mind. Yeah. In 2008, Thầy asked me to come to Germany to establish the European Institute of Applied Buddhism. And after a few years, Thầy told me to invite John Kabat-Zinn to come to the institute, as well as other researchers, mindfulness researchers, to teach at our institute. But our institute is so not completely established yet. So I didn't dare to invite John to come or other leading researcher in mindfulness to come. When I first came to Germany, we spent 6 months to be together. And we didn't open ourselves to the public. I told my brother and sister that we will be together for 6 months together. Every week, we will have a Dharma talk. We practice beginning anew, and we learn to know each other, to understand each other, to connect to each other before we are setting up this institute. Because if we do not understand each other, if we cannot take root into each other, love cannot blossom. We can only have the blossoming of love when we connect to other people. So this European Institute of Applied Buddhism is a manifestation of love from Thầy. Really, he is scared for the people. And he's scared for the world. So unless this love is blossoming into our heart, in our heart, we cannot transmit that. We cannot pass it on. So for 6 months, we practice together, having good time together, learning to work together. Because each one of us come from a different background, different community. So we learn to be together first. So may I suggest that this new center, if you can spend 6 months just doing nothing, just practice mindfulness, doing nothing, and I'm sure that our supporter will have enough money to support our researcher to practice mindfulness, to be together, connect deeply to each other, and to allow love to blossom in the heart. Because what is the purpose of providing public health if we do not have love in our heart? We can only provide public health when we have this deep love in our heart. And I think that when it comes to the public health, I think the way we do research can be different from a normal scientific research, in the sense that we have to be a participant in the process. We have to be a participant in the process to provide the public health. We cannot only be an observer or a theoretician, creating a model, creating a framework for people to follow. But ourselves, we do not benefit from this work. So we need to be a practitioner at the same time as a scientist, definitely for this center. We should be able to provide health to our family, health to our daughter, our son, our partner. We should be able to listen deeply to our partner, to treasure the uniqueness of that individual, and to listen to him or to her without any judgment. It's so important, because if we cannot do that, if we not listen to our partner without judgment, how can we evaluate our data, scientific data, without judgment? We can only see things through a perspective. And unless we have open mind, completely open mind, then we can see the data as it is. Otherwise, we just try to manipulate, or we don't know. Unconsciously, we manipulate the data according to our wish, to provide a framework for what we think is right. So we need to come back to ourselves, to be deeply connected and practice, and truly a practitioner. At the same time, truly be a scientist, a true scientist, in the sense of completely transparent, open, and happy with what it is. And mindfulness, I think the movement of mindfulness has now reached the point that we have to go further into the community-based practice. 1975 or 1976, they wrote The Miracle of Mindfulness. We can say that it's only a title. He can also say that the miracle of love, the miracle of compassion, the miracle of understanding, the miracle of connectedness. But he chose the word mindfulness. Mindfulness doesn't have to be mindfulness. Mindfulness including compassion, include understanding, include everything. Yeah. Okay, it's end section. Okay, thank you. Okay, I'm reminded it's my time's off. But I think it's good enough. I think that the researcher, we have to go beyond this idea of measurement. Because for the last 15 years at my institute, every week I organize courses from Thursday night until Sunday. And we can see how people change. Thursday night, the energy is very heavy. People come with so much difficulty. There are people who would like to commit suicide, and there are many other forms. But when they come to the practice, only for a few days, they completely change. What kind of measurement, scientific measurement that we can do? So I think that doing research in this area, we have to go beyond the concept of measurement, because they are artificial characteristics that we have set up from our own point of view. But it's not really what happened in the reality. And the public health, the Center for Mindfulness in Public Health, I think has to organize these form of courses, 3 days courses or 4-day courses. And from these, you can learn and you can see people transformation. And that is a fact. And that is a data set that you can work on. So I suggest that the center should be a retreat center, that you offer retreat for people to come. Okay, anyway, there's other thing, crazy idea, but my time's up, so I end it here. Thank you very much for all listening.
Thank you. Thank you so much. What an exciting array. You may not appreciate Walter Willett as a scientist is the most cited faculty member at Harvard University. And
It's the whole world. It's true.
I understated Walter's achievement. But that's, an occupational hazard I have. But we so admire your leadership, Walter, on every dimension, and so appreciative of your joining in this effort in such a powerful way. And Elli, I could only wish to be one of your students. I hope that you will help us to think what it would mean to create an entire university community who practiced and learned together in the manner that you have pioneered. It's very inspiring. And Zev, you are a model of collaboration in the work you do, in the attitude you bring, in the experience and insight that you bring to us, including the vital ideas of inclusiveness in the composition of the center. And we thank you for that and look forward to working with you. And I must say, Brother Phap, the idea of being a participant in the practice, I believe if we can absorb and incorporate that central concept in all that the center does, we will have been greatly advantaged by that insight alone through the course of this day. So thank you so much for that. And for all of us who have been privileged to be part of this program, I think teachers live on in their teachings and in their disciples. And if that is so, Thich Nhat Hanh is very much with us, still today and for many, many years in the future. We've experienced this day because of the brilliance and participation of all the presenters. I want to thank especially all the monastics who have joined us and shared their judgment and lack of judgment. We have learned from you in every respect throughout the course of this day. I want to thank the organizers and the staff who put together every aspect of the program. I want to thank the Plum Village community, especially of Engaged Buddhism, the Thich Nhat Hanh Foundation, the Parallax Press for their generous contributions and support, Harvard Bookstore as well, and all of the staff who have helped in organizing and making this day such a joyful experience and such a successful learning experience. I invite all of us now to remain in the moment while I invite the monastics to share with us a chant. And as they come up, please join me again in thanking the panelists from our final session.
So I repeat it again. Dear respected Thầy, dear respected honored guest, dear respected brother and sister in the community, we would like to offer this chant to our new center as a blessing. And with this chant, Thầy is here with us. He has this chant every time when he comes to an event with the presence of the brother and sister, monastic brother and sister. So Thầy is here with us tonight to all of the monastic and to all of us here in the room. And we would like to honor Thei's work, and we would like to congratulate the organizer for having this successful event and for establishing this center in honor of Thầy. Thank you so much. And we will come back to our in-breath and out-breath. We would like to invite everyone to sit with your back straight and your shoulder relaxed. We enjoy our in-breath and out-breath. Come back to ourselves. Feel ourselves deeply and allowing the energy of compassion to come up through the chant, to embrace the difficulty in our heart, the pain, the sorrow, the physical pain as well as the mental pain, and to allow this energy of compassion to heal ourselves and to think of the world that we are in right now with so much difficulty, war, climate change, violence, so many tragedy that's happening right now in the world. And may the energy of peace that we generate the whole day today and our good intention for creating this center be a blessing for the world, be a direction for the world, and be a foundation of peace for the world. Thank you. Thank you. Thank you.
When was the last time you were at a scientific meeting that ended this way? That was. Can we just maybe thank them so much? That was really beautiful. Thank you so much, and thank all of the monastics who traveled from around the world to join us today. Harvey already thanked all the people who made this happen, so I just want to thank everyone who attended today. I know everyone has a full schedule, but we have a lot on our plate to digest over the coming weeks and years. And finally wanted to thank Brother Phap for his sharing of the big picture vision of what might happen 30 years from now. And who knows? 30 years ago, we wouldn't have imagined this happening today. So again, thanks everyone for joining us.